Hello guys, this is Avdesh. Today's our topic is Axilla. तो guys, जिसे हम Axilla, जिसको हम ले लैंग्वेज में एक आर्मपिट कहते हैं, जो कि एक पिरामिडल स्पेस है. यह एक पिरामिडल स्पेस है, जैसा कि आप देख पा रहे हैं पिक्चर में. एक रफ डायग्राम मैंने बना रखा है, जिसको अपन एक पिरामिडल स्पेस है जो कि प्रेजेंट होता है इन बिटवीन द अपर पार्ट ऑफ द आर्म, that is humerus, and the chest wall, lateral wall of chest. Okay guys, it has mainly four-sided, as you know, a pyramid is four-sided structure which contains an apex. This one is the apex region and this one is the base region, and it has four walls, that is medial wall and the lateral wall and the anterior wall, which is an imaginary because this is the sheet is 2D diagram, and the posterior wall. So now we will talk about the apex. We will talk about the apex region, and for apex we come to here. First of all, we will firstly understand the structure of the axilla. Axilla has it forms a canal that is known as cervico-axillary canal, which forms a cervico-axillary canal, which you can see here only. It forms a canal like a structure in apex that is known as cervico-axillary canal. Cervico-axillary canal. So we will first understand the cervico-axillary canal. What is cervico-axillary canal? It has three boundaries mainly. Cervico-axillary canal has mainly three boundaries. First of all, when we see this cervico-axillary canal in the apex, the medial boundary is the medially it is bounded by the first rib, the outer border of the first rib. As we all know that this structure is for first rib of our chest cavity. First rib, the outer boundary of first rib is forming the medial boundary of cervico-axillary canal. And when we will talk about the anterior boundary, then the anterior boundary is formed by the clavicle, especially the posterior surface of the clavicle forms the anterior boundary of cervico-axillary canal. And the posterior boundary, we can say the lateral or posterolateral boundary of apex or cervico-axillary canal is formed by the superior surface, superior border of scapula, and medial aspect of coracoid process. Superior border of scapula and medial aspect of coracoid process. So guys, this is all about the apex or cervico-axillary canal, in which a cervico-axillary canal, the content of cervico-axillary canal, as we can see here, the cervico-axillary canal passes axillary arteries, axillary vein, and the brachial plexus. Now we will talk about the main thing about the axilla, which has four walls. First one is like anterior wall. We will talk about the anterior wall. Anterior wall, which is formed by the pectoralis major muscles. Which is present in front, and after that we have a clavipectoral fascia. And after that we have pectoralis minor muscles. So guys, in anterior wall we have three structures: pectoralis major muscles, clavipectoral fascia, and pectoralis minor muscles. Now we will talk about the medial wall. Firstly, we will talk about the medial wall, in which it is laterally convex. Medial wall is laterally convex because this is the medial wall is the part of chest, so that it is laterally convex. And it contains upper four ribs upper forearm, first, second, third, fourth, with intercostal muscles, including, like you can understand like this one is first rib, then in this the muscles, then second rib, and then muscles. So that's why I have written here the upper four ribs with intercostal muscles and the upper part of serratus anterior muscles. As we all know that the serratus anterior muscles present here. Now we will talk about the posterior wall, which is formed by the subscapularis muscles above present subscapularis muscles, then teres major muscles, and latissimus dorsi muscles very below, it is present below latissimus dorsi muscles, which is a back muscles. As we all know that this is the back muscles. And now we will talk about the lateral wall, which is very narrow. As we can see here, this is very narrow, which is very narrow, and it forms the upper part of the humerus, upper part of humerus, shaft of the humerus, and it is present in the region of bicipital groove. That's why I have written here the region of bicipital groove, because it is present in the bicipital groove region. And it contains also a coracobrachialis and short head of biceps brachii muscles, short head of coracobrachialis muscles, and coracobrachialis and short head of biceps brachii muscles. Now we will talk about the base. Now we will come to the base. Base is this structure is formed by the base. This structure is formed by the base. So base, it is a convex, upwards convex, and formed by the skin and axillary fascia. And it is bounded by, the base. Boundary of the base is formed by the base directed downwards. It is actually directed downwards and formed by skin and axillary fascia. And now its boundary is anterior axillary fold. Anteriorly it is bounded by anterior axillary fold, which is formed by the lower border of pectoralis major muscles, guys. And posteriorly it is formed by the posterior axillary fold or posterior axillary lines. Now it is formed by the tendon of latissimus dorsi muscles and teres major muscles and subscapularis muscles, and it is medially bounded by, look at this one is anterior boundary, this one is anterior boundary, this one is posterior boundary, and this one is medial boundary. So now we will talk about the medial boundary of the base of the axilla, which is formed by the lateral aspect of chest wall. So it is quite like concave like this one, and medial axillary line, which is a medial axillary, it crosses medial axillary line. Now guys, we will talk about the whole content of the axilla. The content of axilla contains, first of all we will talk about the content of axilla. As first one is axillary artery. It contains axillary artery and its branches, that is first, second and third branches. First contains 1 branches, and second part contains 2 branches, and third part contains 3 branches. We will talk in next video in axillary, when we will learn about the axillary artery and its branches. Then we will study about the whole its branches. Now, right now we will talking about just content of the axilla. That's why I am saying the axillary artery and its branches. After that, it contains axillary veins and its tributaries by which it forms. Axillary vein forms with the help of its tributaries. And after that, it has infraclavicular part of brachial plexus. It has also brachial plexus, but which part? That is infraclavicular part of brachial plexus. Now it also has long thoracic nerve, whose root value is C5 and C6, C7, and intercostobrachial nerves, which arises from the T2 thoracic second vertebra at the level of thoracic second vertebra. And after that we have axillary lymph nodes, where it also contains axillary lymph nodes, that is anterior lymph nodes and posterior, lateral, central and apical lymph nodes. 5 types of lymph nodes present here, that is axillary lymph nodes, which is known as axillary lymph nodes. And also it contains axillary fat and areolar tissues inside it. Now we will talk very little bit about the content of clavipectoral fascia. Clavipectoral fascia, which contains cephalic veins and thoracoacromial artery, and which is a branch of axillary artery. And after that, lateral pectoral nerve, which is arises from lateral cord of brachial plexus, and apical lymph node axillary artery. So guys, this is all about I hope you have understood the axilla, and this is all about the axilla. And thank you so much. We will learn more about axillary. In next video we will learn about the axillary artery and its branches. And आपको अगर ये वीडियो पसंद आया हो तो लाइक, शेयर एंड सब्सक्राइब कर लीजिए. थैंक यू सो मच.